Mr. Sharma had pain on walking for 2 to 3 years. The pain had gotten progressively worse and he now could barely walk 100 to 150 meters before he would have intense pain in his calves and stop walking.
दर्द मेरे को ऐसा है कि ये टांग मेरे में इतना दर्द था कि मैं चलता था तो मेरे को बहुत दर्द होती थी ऐसे ये चीज़ जो है इतनी टाइट हो जाती थी कि मेरे को रुकना पड़ता था 2-4 मिनट के लिए फिर मैं चलता था.
What Mr. Sharma has is called peripheral arterial disease and the pain that he's having is called claudication. Unfortunately, this is not always diagnosed and remains underappreciated in patients.
So the case we actually started out with is one of Sameer's personal patients who he has treated and is a classic example of claudication.
So today, let us understand what is peripheral arterial disease and what you should know about it. Welcome to Doctors on Call. I'm Dr. Sameer Gupta.
And I'm Dr. Sonia Lal Gupta.
Just like you can have blockages in the arteries of your heart, you can also have blockages in any artery of the body. When you have blockages in the arteries of the heart, it's called coronary artery disease. And in other arteries apart from the heart, it's called peripheral arterial disease. These blockages are seen most commonly in the legs. When you have a blockage in the artery of the leg, you will probably be fine at rest, but the legs are not able to keep up with the requirement on walking, causing ischemia and pain in the legs. It is like angina of the heart except in the legs, and this is called claudication. This pain is most commonly experienced in the calves but can also be on the thighs and buttocks. Left untreated and in more severe cases with more blockages, especially when you get hurt, you can have more serious issues like gangrene and even requiring amputation. The foot starts changing color, turns blue and black, and needs urgent treatment. Some causes of peripheral arterial disease are diabetes, hypertension, smoking, high cholesterol, and age. The older you are, the more at risk. Now there are different ways to determine if you have any blockages. The simplest and the easiest is called an ABI or an ankle brachial index. An ABI is a ratio of the blood pressure in the arm and legs. Normally the pressure in the arms and legs is about the same, and a normal ABI is about 1. Now most international guidelines actually recommend an ABI in all adults aged 65 and older, adults more than 50 with a history of smoking or diabetes, or an adult of any age with exertional leg symptoms or a non-healing wound. The treatment is actually determined by where the blockages are, how many blockages there are, and the severity of the blockage. The treatment can either be with just medicines, or in some cases patients may require stents, and in some more cases they may require surgery. But this is all determined depending upon where the blockage is, how long the blockage has been there for, and how many blockages there are. In the case of Mr. Sharma, he had a blockage in the main artery of the leg, which we call the right common iliac artery. We placed a stent in that location. The blockage resolved completely, and in a few hours he was walking and he doesn't have any more pain, and he recovered very well after the procedure.
तो फिर मैं डॉक्टर समीर के पास आया, समीर गुप्ता के. उन्होंने मेरे को कहा कि हम आपको टेस्ट करेंगे आपकी टांग का. तो उन्होंने फिर यहाँ से टेस्ट करा मेरा, तो उसमें फिर उन्होंने कहा कि एक स्टंट नस ब्लॉकेज है, तो वो स्टंट डलेगा तो ठीक हो जाएगा. ऑपरेशन तो नॉर्मल छोटा ही था, लेकिन ये है कि उसमें फिर भी उन्होंने आधा पौना घंटा तो लगाया था. तो जैसे ही उन्होंने मेरे को ऑपरेशन के बाद मेरे को ऐसे महसूस हो रहा था कि जैसे मेरी टांग ये जो चीज़ है ना बिल्कुल नॉर्मल हो गई है, कुछ है ही नहीं इसमें, बिल्कुल ठीक हो गई है.
Now the risk factors for peripheral arterial disease are similar to heart disease, that is smoking, diabetes, hypertension and high cholesterol.
So please take care of your health and make wise choices to keep yourself healthy.
That's all for now. Take care and see you next week on another episode of Doctors on Call.